Good afternoon, everyone. My name is Simran Chaudhary, and I welcome you all on behalf of Voice Up Healthcare to a special initiative and a special conversation with Dr. R.V. Asokan, National President of Indian Medical Association. Thank you so much and welcome to our show, sir.
Thank you so much.
Thanks a lot. So, we are honored to have Dr. R.V. Asokan with us. His notable contribution include establishing the IMAGE project for biomedical waste management, leading a rupees 100 crore global fund to fight AIDS, tuberculosis and malaria for public-private mix project, and to IMA, and influencing international TB standards through his work with WHO. Thank you, Dr. Asokan, for coming to this interview.
Thank you so much.
So, this conversation is regarding the recent budget, which was on 23rd of July, announced by our Finance Minister, Ms. Nirmala Sitharaman. This was her 7th consecutive budget. So, it's regarding that, sir. So, I would like to know, how do you evaluate this recent healthcare budget presented by our Finance Minister, Nirmala Sitharaman, where Ministry of Health and Family Welfare almost got around 87,000 crore? And the main highlights is the exemption of diagnostics, this equipment's exemption on cancer or on custom duty to main cancer 3 drugs. And do you believe that it addresses the critical need of the healthcare sector, and is it enough at this point of time?
It's too little and too late. And the mismatch between expectations and the budgetary allocations is almost always the constant thing regarding health. Health, once again, has not been prioritized. That is our concern. We have been advocating for an allotment of 2.5% of GDP. What we get is around 1.1% of GDP, out of which 2/3 comes from the state governments. So 1/3 comes from union government. And this time, if you see, 1% of 4 trillion economy is 3,65,000 crores. And even you include the research fund, it becomes only 90,000 crores. That is roughly 1/4. So actually, the union government's contribution in health has gone down from 1/3 to 1/4. That's a big hole in what we expect. Or in other words, I am saying, apart from providing for the inflation, becoming a 4 trillion economy has not given proportionate allocation to health. It's not proportionate even to that extent. So the main issue of percentage of expectation, if you look at it, roughly it is 1/50th of the budget. It's around 48 lakh crores that they have budgeted. 90,000 works out to 150, one part in 50. It's too little for 1.4 billion people to have, we expect the government to be the leader in health. Yeah. We do not want the government to leave it to the private sector to address the healthcare needs. Private sector is a different concept, it's a different working area. We cannot leave the entire health needs of the country to private sector. Government should take the leadership, invest in public hospitals, public infrastructure and public human resources.
I think you said it right, sir, because after pandemic, we saw how much care we require in healthcare.
Yes.
So that is there, and we believe that if not this year, but next year, we may get something more than this.
Yeah, lesson came out in the pandemic. What was the difference between advanced economies like United States, which spend 15% of their 28 trillion economy, still they failed to save their people. But even with this, we were able to stop COVID because of our public hospitals, because of our public health infrastructure, and our own vaccines. Otherwise, it would have been much more disastrous.
That's right. So there's another question when we're talking about the GDP. So this is the target of National Health Policy 2017 aimed to increase the health expenditure of the government by 2.5% of the GDP by 2025. But this year also we have fall short of it. So what could be the reason behind it according to you? And when we'll be able to achieve it? And how, if we are able to achieve it, how will it impact our healthcare sector?
It is impacting the healthcare sector because, the main programs that are being run by the government and the support that is being given by the union government to the state governments come from this budget. And this allocation is important. There are two things why this is not happening. Health, when it comes to the national level, perhaps not the issue of concern for the people. For the people, there are bigger things. There are bigger things like poverty, unemployment, defense of the country. Maybe this is reflecting in the aspirations of the people is reflecting. People are able to think that these are the priority areas and health has not really captured their imagination. At least two examples of state governments where people exercise this care or this decision is one in Kerala. The second innings that has been given to the current government is certainly because the way that they managed the COVID. And the iconic health minister, the lady health minister who was able to perform in which drew the attention of the world. The second thing, the health parameters or the health agenda of the Delhi government. This Mohalla clinics, those innovative ideas, that also helped this government to come back. I personally think health being a state subject, people have that wisdom to choose, but I think at some point of time they will exercise this same franchise to health at some point of time.
Yes, sir. I think you said it right because people have that wisdom.
Yes, yes.
So, if we're talking about mohalla clinics, and let's talk about rural and remote areas because it is difficult to reach there. It is difficult to reach masses where awareness is less, where equipment to reach out there is very difficult. So, what are your thoughts on budget's approach to addressing healthcare needs in the remote areas? Are there any specific strategies or investment you would recommend to enhance healthcare in these regions?
It needs a very radical change. What we have right now by way of primary health centers and sub-centers is at least 70 years old. It's as old as the nation. It's from the Board Committee of 1946 that this structure of primary health care flows. Created in 1950s, it was designed for a certain amount of unit population and the doctor availability at that point of time. So the doctor was there only in the primary health center. Today, the number of doctors has exploded beyond your belief. We are the largest doctor creating nation in the world. 706 medical colleges, 108,000 plus doctors coming out every year. Actually, doctors are unemployed and they are looking for employment with the government. And not only the primary health centers, there are around 5 or 6 sub-centers which are attached to every health centers. Time has come that every sub-center should have a doctor, a paramedical, even a lab assistant should be there. So I think it needs a radical revamping of the entire system.
I think so. To reach there, to attract each and every person or to treat the person of remote areas, we have to be there.
Yeah.
So talking about this current budget which was just released and comparison to the previous budget. So how does the recent budget compare with the previous healthcare budget in terms of allocation of policy initiatives? And have there been any noticeable improvement or regressions according to you?
There is regression. Certainly there is regression because, the quantity of money that they have given is certainly not even commensurate with whatever they were giving. Proportionate to the economy. You have to, how much you get, then you give us that percentage. This percentage has remained same. Except for PMJAY, I cannot think of anything substantial.
Yes.
Anything substantial. PMJAY has a vision. But, on the ground, it's still yet to prove itself. Or even its sustainability has not been proved. So, except for PMJAY, there has been no vision in the health budgets. We cannot really say the allocation or policy-wise there has been a difference.
I think so, and we might overcome this difference in the next coming years.
Yeah, we need somebody with a vision, a health minister, a super health minister. We need to change the situation.
So, as we were talking about the previous healthcare budget, so can you highlight some of the healthcare plans and schemes from previous budget that have been particularly successful or shown promising result? What factors do attribute to their success?
Our TB program, the best man has ever made. Not only Indian government, or any government. A public health program of this nature, and what a failure was our earlier TB program. And the RNTCP, which came in 1992 with DOT strategy, then later Stop TB strategy, now with the NTB strategy. This program is something which you cannot really think it's a government program. It's not the same drugs, it's not the same diagnosis which we have. Medicine also has moved, and more than that, the program has moved. Yeah. Program has moved radically in that, the cartridges or the cartridge-based diagnosis of molecular diagnosis, which is right now available, the Gene Expert or the TrueNat, they have been captured, upscale within a decade. So much so, when COVID struck, it was actually the TB program which saved the nation, because they lent their cartridges, their machines for TB diagnosis. And the level of care that they are able to provide for drug-resistant TB, amazing. There are some hiccups like drug shortages which have come, but I think we are in place for 2030. The actual end point is 2030 for NTB program. Our Prime Minister, with his courage, has said it is 2025. This year, it shows a lot of change. Even a private sector could not have done so much of a success. So our TB program is one thing which needs a lot of study why it succeeded. Other programs can perhaps study the way that they have functioned, and so this is one thing I would like to show.
So like you mentioned about the TB program, which is a success by government. Any other program which can be released for the public awareness or the public health campaigns? Like we have hepatitis, we have thalassemia, we have hemophilia. So do you think any such campaign is required at this point of time, which can, follow the path of this TB program to be successful and is needed?
One thing which can have, a low-hanging fruit was the right direction. Last year budget, Srimati Nirmala Sitharaman brought in the HPV. Cervical cancer is one area. It can be completely eradicated. There is no reason why India should not do it. We are capable of doing. We have everything. We have the vaccines, we have the doctors, we have the public health setup to give it to the people. The political will is missing.
We have the support as well.
Last year it was announced, but it's being rolled down only now. It has not reached the ground at all. It has not reached the ground.
My next question was on that only, sir.
Okay.
Finance Minister Nirmala Sitharaman announced about the HPV-free vaccine for 9 to 14 years of girls and some expansion in PMJAY scheme as well. How do you think how far it has gone? Is it been on ground? Like you said, it is not on ground as of now. And what could be the reasons behind that?
You mean HPV vaccination program?
Yes.
I don't know. Maybe the elections, the too much politicization of the attention was. I really don't know because out of allocation, 8,600 crores were not used in the last budget. 8,600 crores of money allotted last year was not used by the health ministry. So the efficiency of 8,600 crores is not it's almost the allotment that you are giving to PMJY. It could have easily taken the HPV. At least one more disease we would have eradicated. Right?
It's a lot of money.
Yeah, that is one area. There is something called education and health cess.
Okay.
We don't know what that money goes. That money is there. Our CAG has commented before a couple of years, not this budget, the earlier budget. He has commented that this money was allotted. The accounting process for this cess money, which is around 24,000 plus crores, has not gone into health. It went into consolidated India budget, India funds, consolidated funds of India, because the accounting pathway was not delineated. It was introduced in 2018. Health cess was introduced in 2018 by Nitin Jaitley. Health cess is for health. You cannot use it for anywhere else. You cannot use it for anywhere else. Now he has pulled up, CAG has pulled it up, that why this money which was allotted for certain particular purpose, especially for the rural infrastructure, your area of interest, and for below poverty people, why it was allowed to remain with consolidated funds of India. That's a very valid question he has asked. That has not been answered now also. We do not know. There is nothing in the public domain to tell us how much money is there in health cess fund, how much money has been used, how much money is remaining. It's not in the public domain. So this is another area. The other one is that even out of the budget which was allotted, 8,600 crores was not used. So somewhere we need that efficiency.
And I agree, sir. Because this time, as compared to the previous year, we have got, it's 10.5% more than the revised allocation of budget. So in that earlier it was 71,000 some crores and now we got 87,000. So if the money is increased, then that should be used for healthcare sector only.
Yeah, no, this increase is, it's notional. It's not in absolute terms. Did you ask about PMJY?
Yes.
Should I answer on PMJY also? PMJY is a disappointment. It's a disappointment because such a visionary leader creating this thing, the team letting him down. That's what we feel about this thing. PMJY is something, if you fully monetize, you need 1,68,000 crores in a year. It doesn't need rocket science. You calculate what they are saying and you just find out what is the money. It's 1,68,000 crores. Something which has been, underfunded to this extent will not work, will collapse. And the increase in the beneficiary number, which is obviously political, 66% of the PMJY is used on the government hospitals. Now, you fund the government hospitals directly. When a patient goes to a government hospital, the care is anyway free. Now, a patient approaching government hospital for care, for that paying the government hospital through an insurance company paying them 15% of the money, how does that help? Is it the way to fund public hospitals? 300 procedures have been kept away from the private sector. In our opinion, PMJY, you fund your public structure directly, no insurance company in between. Why give them 15% of the money in thousands of crores, what it is? How are they related to health? Government is related to health, hospitals are related to health, but how are companies, insurance companies, they are profit-making bodies. They don't have any sensitivity to the health needs of the country. Why involve them? Fund them directly. You are a hospital, you have money, give them directly. Why do you need a insurance company to take away 15% when you do it through PMJY? In PMJY, our opinion is reserve it for only strategic purchase from private sector. Reserve it. Suppose in a district, a below poverty level poor person wants a certain care not available in the government sector. For him, buy that care strategically. It cannot be a blanket thing. Every district will have to customize what is needed for the poor. So this thing should be reserved entirely for that purpose. 66% of the money going to government sector is actually, it's not correct. You can do it directly. Why route it through PMJY?
If it is the assurance/insurance scheme by the government, then they do not need a middle person.
Yeah, why do they need a middle person? It's your people, your government.
So we talked about private sector as well. So how do you see the role of private sector in complementing the government's efforts in healthcare? Are there any budgetary provisions of policies that facilitate better public-private partnership in healthcare sectors? Because we saw during the pandemic how public and the government and private partnership helped India to overcome the COVID-19. So this time, how can it be facilitated?
Private-public partnership is a difficult area of work because the government is not only a stakeholder, it's also the regulator. So there is a conflict of interest with the private sector. When you want a partnership, as well as when you are the government and the regulator, it doesn't work. It's difficult to work private-public partnership. It's preferable to leave the private sector to be what it is. Right? And government, let it be the regulator. People will choose. Why do you want to disturb another sector? And 4% of the healthcare expenditure, 4% of the GDP is our national health expenditure, which amounts to around 13 lakh crores. Yes. And 2.9% of it comes from private expenditure. Only 1.1 comes from there. So who is dominating where? Private. Yeah. But that should not have happened. The governments withdrew from healthcare. They have not come back. We only wish our governments come back into healthcare sector in a dominant way.
Going forward with that, sir, your statement and wrapping up this interview, your expectations for the 2025 to 26 healthcare budget, you think we can do more or we can push on some important health aspects and next year, we can do much better in this?
We can. We are a better economy now. It's only a question of prioritization. If you remember that during tsunami, the Indian then government said, we don't want foreign funds. We are capable of handling. We are capable of handling our healthcare sector. The government is capable. We don't need global fund to help us in TB. We are actually diplomatically keeping them. Our government is capable of looking after only we need a correct direction. the failed insurance model being rolled out as if it is the panacea is unacceptable. It will not take us anywhere. We will create another United States.
Thank you so much.
I think I took more time.
Thank you so much for your insights and
Okay.
experience you shared with us. Thanks a lot. Your time, your efforts, your words matter a lot for us. Thanks a lot.
Okay.